Hello, Dr. Vicki Peterson here. I wanted to share with you today a study that comes to us out of the American Journal of Gastroenterology. What they did was they took a group of children who had no symptoms and they tested them for celiac disease. So the group of children that were entered into the study had no symptoms, and yet they had positive blood tests for celiac disease. They then followed them over 9 years, and during that 9-year period, 2/3 of them never developed any intestinal changes that are common to be seen with celiac disease. In other words, their villi, their little finger-like projections that make up the lining of the gut, did not show the damage that is consistent with celiac disease. Footnote, not everyone with celiac disease does establish that kind of damage, but that in the classic celiac sense, celiac disease is classically associated with what's called villous atrophy, which means that the lining of the intestine is eradicated. So those finger-like projections that give the surface area to the small intestine and allow you to absorb your nutrition, in classic celiac, those are eroded and compromised, and that's a classic thing that is seen on biopsy. So these children, 2/3 of them, despite having the positive blood tests, didn't develop the villous atrophy after 9 years. And so the question was, in these, what they deemed these children potential celiac patients, and wondered if, when you fall into that category, should a child go gluten-free or not, considering 2/3 of these children never developed the villous atrophy. So on the one hand, you can look at this and say, well, then probably they didn't need to, because 2/3 of them seemed fine. Well, obviously 1/3 of them weren't. They did develop the villous atrophy. So I want to look at a couple of points. One, you're dealing with children, so they're young, they're resilient, they have a lot of recuperative abilities. Yet, if they have a positive blood test, that is their body's way of saying, their body's immune system way of saying that it is having a problem with gluten. Now, also as I noted earlier, not everyone with celiac disease is going to have villous atrophy. That doesn't mean that they're not having health problems. That doesn't mean that other organs are not being affected. That doesn't mean that they're not much more likely to develop other autoimmune diseases because they have celiac disease. And also recall that a positive biopsy is not the gold standard for celiac diagnosis necessarily. It's one of 5 criteria that, and only 4 out of the 5 of those criteria need to be positive. So a biopsy does not absolutely have to be there positive in order to make the diagnosis of celiac. So if it was my child, I can very clearly tell you what I would do. If I had a child and they had a positive blood test for celiac disease, I absolutely would get them off gluten. And wouldn't it be great if maybe that's why they never developed the villous atrophy, because of course you caught it early. Now, the other thing is that children, as I said, are pretty resilient, and even if they were going to develop the atrophy, realize that when the test was first positive, they had no symptoms. So we know that with autoimmune disease, and celiac is an autoimmune disease, as is rheumatoid arthritis and Sjogren's and fibromyalgia and Parkinson's and over 100 different other diseases, we know that you can find positive antibodies in the blood up to 20 years before the disease manifests. So 9 years sounds like a decent amount of time, but not when it really comes to autoimmune disease. These antibodies start being manufactured, and it can be many, many years before the disease manifests. So it's interesting. I want to present it as food for thought. What would you do? What would you do if it was your child? I think maybe if you had celiac or you had celiac in your family, maybe that positive blood test is enough, and you get them off gluten and you prevent that damage. Do you really want to play that kind of Russian roulette with your child and their health, knowing all the terrible diseases associated secondarily with celiac, cancer, and a whole host of other autoimmune diseases and malabsorption? And I mean, this is a difficult condition. It really, really is. So I don't necessarily agree with the researchers in this case. They were sort of putting out there that in a potential celiac case like this where the blood test is positive, that maybe it's too soon to put the children on a gluten-free diet. So I don't necessarily agree. You can let me know what you think, but that's the data for you. And please let me know your questions and opinions. And until next time, I wish you very good health.